I'm the director of the MSc programme in the Division of Psychiatry. My other roles are I'm a clinical academic doing research in the Division of Psychiatry, and I'm also a clinical psychiatrist. I do early intervention in psychosis. My research is on looking at partly at models of mental health care for people with serious mental health problems and what works. And also I'm increasingly focusing on social influences on mental health. Obviously I teach on various of the modules. I run the psychosis module and I teach on the as well as the core research one, the mental health policy one, and I'll be teaching on our new mental health in social and global context module, and I'll talk about my research in those contexts. I also offer, with colleagues in my group, several projects each year for people who are interested in pursuing any of those things. And we also actually have quite a few placement students working alongside our group. Our course is quite research-based. We have a clinical module which I hope gives people real exposure to what clinicians do, to what people with lived experience think about mental health services, think about their treatment, what sort of experiences they've had. But much of the course is very rooted in research and very much taught by people who do research. And I hope that gives people a much greater sense of what mental health research is really about what the pressing questions are right now and how they're being currently addressed. I'd hope as well that we turn out people who've got some very practical skills. So we aim that people can not just write an essay, but they can write a questionnaire, they can write a protocol, they can write a blog. We've got a partnership with the Mental Health blogger, and lots of our students go on to blog for him or to, in other forums, try and disseminate their work publicly, which we think is really important. We also aim for people to become very confident at presenting and very confident at working both individually and in a team. So a lot of our course design is to try and make sure people have the relevant subject-specific knowledge, but also to try and help people move towards having that kind of skill set that will really benefit them at the next stage. Well, the Clinical Mental Health Sciences MSc is the one for which we have quite a large cohort, probably about half people who've come straight from psychology degrees and half people who've got a bit of further experience of one kind or another before coming. They're not generally clinicians, however, and one of the things, the distinctive thing we offer on the Clinical Mental Health Sciences MSc is this clinical mental health module, which aims to bring people up to speed with an understanding of the main mental health conditions they might encounter, how in practice those are managed in the current NHS. What, as I say, we have quite a lot, we've actually increasingly have a lot of people with personal experience of using services coming and talking to students on that module. The Mental Health Sciences Research MSc is intended for clinicians and people are for clinicians or people who've got quite a bit of experience already with clinical populations, and people do largely quite research-focused modules, although we let people have a fair amount of choice really on both MScs. We have a fairly sort of elaborate structure in place in the Division of Psychiatry that I hope means people are well supported. People have a personal tutor in the sort of way that's standard, I think, on many courses. But we also have a system of study groups, which means that everyone's put in a group with their peers. They have allocated to that group both an academic and a postdoc or PhD student, which means they develop a sort of reasonably close connection with some people in the division, and they also get to know well and work together with a group of their peers. We also have a student mentor, someone called Sarah Dowling, who's someone people can approach with problems like accommodation problems or not knowing where to go for maybe for mental health help or a variety of forms of help. And I think we have a bigger course team, a bigger dedicated team for the course than most master's courses would. So working along with me, I've got a very kind of sparky and enthusiastic group of lecturers and senior lecturers who I hope pretty available and well known to people on the course. So I think most people would have a range of people, I hope, who they'd feel they've got a connection with and can go for help and support. Our overall aim really is to turn out people who, if they're not clinicians, will be excellent research assistants, PhD students, clinical assistant psychologists, maybe on the route to clinical psychology, maybe on the route to a career in mental health research. But we'd like to get people to a point where they're ready to do really well with the next step. For clinicians taking the MSc in Mental Health Sciences research, our aim is basically that people are ready to embark confidently on a PhD if that's what they decide they'd like to do next. We started the course in 2014 and we're now seeing quite a few of our sort of early graduates embark on clinical psychology work. I think people emerge from the masters with probably a better sense of the sort of broad range of mental health related careers that there are and are choosing a variety. I think the course is quite difficult actually, or at least quite challenging, and actually deliberately so. We don't want it to be a kind of easy masters where you pay your fee and attend some lectures and have some essay crises and get awarded a degree that perhaps hasn't taken up a huge amount of time. So I think the course is demanding and needs quite a lot of investment of time. But certainly we seem these days to be able to be relatively selective, and I think one of the joys of coming on the course for the students is likely to be the peer group, that we do have a group of very bright and enthusiastic young people coming from, or mostly young, not all, people coming from a sort of wide range of places and backgrounds. And I think that's one of the things that means I say to people it's an exciting thing to do. But I think it is, we set it at a level to challenge that kind of very able student cohort. So I think we'd say unapologetically that it is quite challenging, but that we feel it's challenging for a reason, that we're hoping people will move on quite a long way in the course of a year and develop quite a lot of new skills and new experience. The course has, this year we have a cohort of I think about 75 clinical mental health sciences students and about a dozen mental health sciences research students. I think about 3/4 of our students enter as full-timers and the rest, particularly often the clinicians, are part-time. We have had to, at the moment I think the closing date is officially in June, but actually we've had to bring forward closing dates, and we've also been in a situation where we've had to be incredibly picky. Towards the end of the period we've been open, because we've been running out of places, we've again had big demand for the course this year. So I think, apply soon is the message, basically. There are some scholarships of up to £2,000, which the Division of Psychiatry awards. We award them for particularly people who make the case that they are promising as researchers. So we award a variable number of those, up to, I think we've awarded up to about £14,000 worth of those scholarships. Our local trusts offer scholarships for clinicians, so people who are clinicians working basically across North London's mental health services can get in touch with us and find out about the funding that's offered by that route. Otherwise, we have, I think, quite a lot of overseas and European students who are scholarship funded, but that tends to be by resources from their own country. There is also an option now of through the ESRC doctoral school applying for 1+3 funding. So for people who know that they would like to do a PhD afterwards, there is that option, but that's something that needs to be applied for quite early in the academic year. But we'd be eager actually to see more applications for our 1+3 ESRC studentships.